Welcome to Sashga and OMGFit Health channel. Today I will be speaking about PCOS, a polycystic ovary syndrome, and weight gain. We all at some stage in life struggle with weight gain, but females with PCOS, they are at a constant struggle with losing weight because of the variants that cause them that caused that struggle, just to put it quickly. I hope you can see what I've written here. If not, that's okay. I will still speak about these points and you will definitely know what I've written. So females with PCOS, that's the topic, and weight gain. So this is a high level hormone that trouble females at childbearing age. Okay, what this hormone does, it create a high level of male hormone. So females with PCOS, they will find themselves with a high level of male hormone, less sensitive to insulin, hence it create overweight or obesity, and then they are at a higher risk for chronic disease. I'm going to go through each point right here. Let's start with less sensitive to insulin. Insulin is an hormone in the body. This breaks down starch and sugar from the food into energy. This is where we get the energy to exercise right, do our daily activity, okay? So there is insulin resistance, and this is a condition that create the sugar, glucose, or the blood sugar to build up in the bloodstream. If there's a buildup in the bloodstream, guess what? There is obesity, there is overweight, and hence there can be chronic disease, hence diabetes, for example. So the high insulin level, because of PCOS and insulin resistance, meaning food, starch are not broken down into energy or converting to energy, there is a high level of insulin. Now, with that high level of insulin, there is a male hormone called androgen. You may not see it there, but it's written right here, androgen, ANDROGEN. So high insulin level increase production of male hormone called androgen. With this androgen, it creates irregular periods or mens, high level of fat in the abdominal or the stomach area, acne, and increased growth hair or body hair. Okay. So this is what is going on with females with PCOS. They are less sensitive to insulin, high level of male hormone. This male hormone is what causes fat in the stomach area. And this is because male normally gain fat in the abdominal area. And abdominal fat is very dangerous because it triggers heart conditions, obesity, chronic disease. So if females with PCOS ignore this weight gain, they're ignoring fat covering their organs, which is bad fat. They're ignore being in risk for high chronic disease such as diabetes, heart issues, and at the same time with irregular menstruation, they're at risk of with childbearing. So we want to stay healthy, okay? How do we stay healthy? How do we control our weight with PCOS? I write it right here, 10%. 10%, that's all we need. All females need with PCOS, polycystic ovary syndrome, is to lose at least 10% of weight. With 10% of weight, you can control what you call the conditions of PCOS, meaning you can lower insulin sensitivity. If you lower insulin sensitivity, that means your food, your starches will be converted into energy instead of storing into the bloodstream as fat or sugar. We can lower the level of male hormones. By lowering insulin, we lower male hormones. By lowering the male hormone androgen, we reduce the fat in our stomach, especially. We reduce our periods become normal again. Female periods are normal again. Reduce acne and reduce body hair on the body all over, because you'll see some females with a lot of hair and you'll be like, oh, it's because of the male hormones. Okay, how do we lose the weight? Yes, we know exercise is one. 30 minutes a day for most days can help, but we want to have a high fiber diet, low sugar diet. Remember the insulin. Because of PCOS, you may have a little bit of insulin resistance, meaning your food is not being converted into energy. It is storing this glucose or blood sugar is being stored in the bloodstream. You want to eat less sugar. So a low sugar diet, a high fiber diet, load up on fruits, vegetables, and whole grain. Eat 4 to 6 small meals a day instead of 2 to 3 big meals. 4 to 6 small meals, what happen is that your metabolism increase because there's always something to burn. And that is what we want, especially with the PCOS. You want your metabolism to keep going, keep burning, keep going. So 4 to 6 small meals instead of 2, 3 big meals, all right? If you smoke or drink, join a program to help you quit. You do not want to have that bad habit with PCOS, especially if you're looking forward to a family. The next thing is, remember to consult your practitioner or healthcare professional before starting any diet or workout, just in case you need that advice. You can do that. Okay, that is quick. That is my little summary on PCOS, polycystic ovary syndrome, and weight gain. So if you find yourself at a difficulty in losing weight, you have irregular periods, you have acne, you have ear growth, you could check that out to see if that is PCOS. If that's his PCOS, you just go on a healthy lifestyle, healthy eating habit, a healthy lifestyle habit, and you'll be perfectly fine. Okay, remember, any other questions, please ask me. I'll be willing to find that time to answer it as quickly as possible. And subscribe to my channel. I'll see you again soon. Bye bye.